There are some conditions that many people think are inevitable and are just part of life, and there's nothing that you can do to prevent it or reverse it. So part of the reason that I'm doing these videos is to disprove that and correct that understanding and help you to realize that there's really simple things you can do to ensure that your body is as pain-free as it possibly can be. So the condition we're going to look at in this video is something called Dowager's hump. It's also called excess kyphosis, and it's essentially that accentuation of the curvature of the upper back. It's said to be a little bit hereditary. Some people believe that they just have to have it because their parents had it. They have to go that way as well, and that's simply not the case. So this is Sarah, one of my patients. Now Sarah came to me in that situation. She was noticing an extension of that curvature in her upper back, and having looked at her father, who was pretty much very curved forward, she was really worried that she was going that way. So let's have a look at when Sarah came to me. She was, assume your position that you were. She was pretty much here. It's a fairly normal level that Sarah was at when I first started treating her. But she was concerned that it was going to get worse and wanted to know if it was possible to correct it. Now, with the extension of the kyphosis, what you also get is when you lift your head up, you get an extension of this lordosis here in the neck. So you get a tightening of the neck muscles. So you start to get a lot of headaches. So it's not a nice condition, and these headaches are also a condition that a lot of people accept is just part of life and it's just going to get worse, and it's simply not. It is so simple to correct it. So with Sarah, we put her through 4 osteopathic treatments just to get some movement through her back, and at the same time she did a yoga program. She's now on a maintenance program. So what I'm going to show you now is the 4 or 5 main exercises that have helped Sarah to correct. So Sarah can assume her position now. So Sarah is a lot straighter, her head's a lot better position. So and we're still working with it, but basically I won't accept that Sarah has to have a curved back, and neither does she now. She also now has a lot less pain in her back and a lot less headaches. So through some simple stretches, we've resolved lots of little things that were niggling her. So let's start looking at her first position, which is the spinal twist, the standing spinal twist. So Sarah, just separate your feet, and if you just want to take yourself through that movement. That's lovely. So just make sure you stay straight and don't lean out. So what you're basically starting with is a really good, simple rotation through the spine. And to the other side. That's it. Very, very simple. Just stay in the midline, head up. Lovely. Good targeted rotation to the area of the back causing the problem. We just want to lock out the rest of the spine and force this area of the back to work. Okay, and come back. And move on to your second exercise. So this is called the Sumo Wrestler. So you start with your knees separated about hip width apart, a little bit wider. Now you don't want your knees to drop forward or backwards. You want your knees to stay in complete alignment with each other. Now she's just going to drop, so you're going to start with your spine straight, Sarah. That's it. And she's going to drop her shoulder and her elbow to the floor and turn her head to look at the ceiling. What you can see here is by keeping the knees in alignment, you're completely locking out the low back here, and you're really targeting right into this upper back here, which is a very difficult area to get to. Often, if you let the knees drop, you get the rotation right into the low back and you lose 50% of the effectiveness of that exercise. So come back to neutral and just repeat the other side. That's lovely. Now this is one of those exercises that you don't know how amazing it is until you try it yourself. So those are 2 exercises that are really good at getting the rotation movement into the spine, but we need to get the extension. She's very, very curved forward, and I want to reverse that and start correcting that. So a very simple exercise I've taught her is just to roll the shoulders back, clasp the hands together, and extend the hands towards the floor, and the head just tips back, chin towards the ceiling slightly. So what you're doing is you're just really getting a forced, localized extension of that spine. So she just holds that gently, breathing, and then releases, and she just does that, say, 5 or 6 times in her own time. You just really enjoy that. You're basically retraining these muscles to hold a new position. That's a very simple exercise. Another one we want to do, though, it's all very well to correct from this side, but you also need to release the tissues from the front so that the back can move backwards. So we need to free up the pectoral muscles. So an exercise that Sarah's done for that is she places her hand against a wall and then just gently turns to her left. And what she's doing here is she's opening up and stretching that pectoral muscles. I have to keep reminding Sarah to keep her head up because people who have an extended kyphosis do tend to stoop with the head as well. That's lovely, and then she just relaxes and repeats that. So get a nice opening up of the chest. The minute you free up the pectoral muscles at the front, you will find you'll instantly start standing straighter and your back will relax and you'll start losing that curve in the upper back. That's it, lovely. Okay. So we're going to move on to the next exercise now, which is called threading the needle. So for this, you need to get onto all fours. Make sure that your hips are in line with your knees and your shoulders are in line with your wrists. And I'm just going to ask Sarah to thread her right arm underneath her left arm. That's it. Now, as you can see, it can be a little bit of strain on the head and neck. So what you can do here, just raise your head, Sarah. You can just put your head on a little pillow if that helps. Now, again, what we're doing here, if Sarah just separates her feet and her knees just a little bit, then we're locking out the low back here. We're getting that fixed and we're getting a huge rotation. You're stretching out the rhomboids, you're stretching out the thoracic spine, the erector spinae. You're forcing all that area that is just fixed and solid to move. Okay, so to come out of that, just push down, that's it, and just come through to the other side. That's fantastic, just thread through. Brilliant. Just hold that as long as you can and just allow those muscles to relax and stretch out. To extend that, you can push back with the shoulder and pull forward with this hand, getting a real corkscrew of a stretch through that thoracic spine. So you push down through this hand and come up. That's lovely. And then just drop your hips back. And then we move back into what we call the half moon child. Now this is to get a side bending movement through the upper back and through the spine, and just to get some movement through the whole spine. Because often when you're getting something like a dowager's hump appearing, it's often because it's compensating for other areas of the back, which I won't go into now, but it's good just to get general movement through the whole spine. So just drop your head down and just walk to the right, Sarah. So you just gently walk around, so you're getting a nice side bending stretch through the whole spine here, and then when you reach your extended position, you just stretch with that inner arm. That's good. And then round to the other side. That's it. Probably only to about there. That's enough. Just get a nice stretch through the thoracic spine and the lumbar spine here. Just kind of getting the spine. You want to get your spine working as a whole and all the parts of the spine moving as they should. You don't want some areas that are really restricted and other areas that are moving too much. So the whole ethos behind using yoga to correct back pain is to get that balance back.